This conference will now be recorded.
Well, good morning, everyone. First of all, welcome. I want to thank everybody for joining us this morning and for the Nacogdoches Stakeholder Conference call. It's great to have you folks with us. Just a couple of announcements. I want to remind you that this conference is being recorded and will be posted later today on the Chamber's YouTube site on the website. So feel free to visit that as well. I do want to let you know that members of the media, our friends in the media, have been invited to monitor this call. Last week, I believe we had 3 or 4 media stories as a result of the call, and I think we can anticipate that as well today. Do want to let you folks know that starting next week, we will not have a call next week. And starting in June, we're going to go to a summer schedule for every other week, which we'll publish that schedule a little further down the road. But we did want to let you folks know that we are changing for the summer and going to an every other week schedule. Having said that, it's my pleasure to introduce our first speaker this morning. She comes to us from our friends at Burke, who provide essential mental health services to those of us in East Texas, and especially here in Nacogdoches County, with their beautiful new facility over there on University. She is the Director of Communications, and today she's going to speak to us on mental health for you and your team. And her name is Reina. Kinnie is familiar to all of us. She's not only involved here at the Chamber and in several different capacities, but she's also doing tremendous work with the folks over at United Way of Nacogdoches, and we're really thrilled to have her so involved in this community. And so would you welcome with me our presenter this morning, Kinnie Reiner. Good morning, Kinnie.
Good morning, Wayne. Thank you so much for having me. I wanted to share with you a little bit. Sometimes I think we don't have enough opportunities to talk about mental health and kind of take a moment to do that, and why I titled this for you and your team. It's things that you can apply to you in your life and to you and your team, and how you work together and how you can help others. I like to convey that as I do have a master in public health and a certified health education specialist, I am not a mental health provider. I'm not a counselor. I'm not a social worker. I am trained as a mental health first aid instructor. And so I can usually take health information and translate it for the layperson. I want to make it understandable and applicable, but today's presentation is not a substitute for therapy or medical treatment. That's my little personal disclaimer that I like to make. But I want it to be something that can, skills that you can, acquire, or it can be a reminder of some things that can help you in everyday life. So what is mental health? I think it's how we think, feel, and act, our emotions, psychologically, our social well-being, how we interact with others. It also helps us, with handling stress and with making choices. How mentally well you are, you may make healthier choices throughout your day or throughout your life. It's important at every stage of life, from childhood and adolescence through adulthood. So it's something that our mental health stays with us. And you can think of, just like physical wellness and, the absence of disease, where it's an absence of an illness or an absence of a disability, no matter where you are in your life, or even if you do have a chronic disease or a disability that you're living with, you can have a level of physical wellness, or you look at a continuum of how healthy that you can be, and it's personal. It's not, comparing apples to apples with every person that you interact with. And so one person's wellness may be at a different point than another person's wellness. And so you can apply that with mental health as well. Somebody that has a bipolar or depression diagnosis can be mentally well because they're managing that with therapy or with medication or with other treatments. with some life skills, with some exercise, different things like that. So we are all on that continuum somewhere. Another thing I like to talk about with mental health is resilience, and that we're all at different levels of resilience in our coping with how things happen to us. And the definition of resilience is basically the slogan that the CVB created, the Visitor Center created, of bend, not break. You know, it's that we're able to recover from or adjust to change, to a misfortune. You know, we have a different level of resilience. Some people, it may take them a little bit to recover from that, and some people just bounce right back and move on. You know, what's next? What else you got, kind of thing. And so respect others with where they are, with their level of resilience, with their level of change. You know, some individuals may be, you know, excited that we're not wearing masks as much, and some people may be hesitant. Maybe they're more vulnerable with having a mask off. You know, maybe they're, you know, just because of where they are, or maybe they're more worried with a mask off than a mask on. So respecting people with where they are. So mental illness is, you know, the conditions that affect people's thinking, feeling, behavior. I like to think of it as the 3 L's. So that's your ability to live, to learn, and to love. Or really it's living, so laughing, it was laughing, learning, and loving, or something like that, you know. And so maybe there's 4 of them. But we, you know, how well can you learn in school? How well can you work? You know, so those are conditions that can affect those abilities to learn and live and work. You know, mental health conditions can be the result of multiple things, not just one thing that happens to an individual. Your genetics, your environment, your lifestyle. Stressful job or home life can make you more susceptible, but it doesn't necessarily cause a mental illness. Traumatic life events, such as maybe a global pandemic or a hurricane, you know, those are things that can have you more susceptible to mental illness. And then there's biochemical processes involved, and circuits and brain structure. All of that is part of our mental well-being and how we're affected by those things. And none of this means that a person with a mental illness, you know, definitely them or their family did something wrong. You know, mental illness is no one's fault. And for many people, recovery, including having meaningful roles in life and in school and in work, it's possible, especially when treatment starts early and you are involved in your recovery process. You know, that's another important role. Is sometimes we hear, you know, and I think with anything, it's like, oh, well, that didn't work for me, or that organization or this organization, you know, they can't help me, you know. And some of it's, well, how much did you put into your recovery and to getting better? And that's a big role. So it definitely is common. It affects more of us than we might think. At home, at work, or school, we may encounter someone that's facing one or more mental health issues. 1 in 5 adults, approximately 44 million Americans, experiences mental illness in a given year. 1 in 25, about 10 million, live with a serious mental illness, such as schizophrenia, major depression, or bipolar disorder. And then we're seeing 17% of youth, 6 to 17, experience a mental health disorder each year also. And 50% of lifetime mental illness, so like when does it happen? You know, a lot of people are asking, when do we see that? And 50% begins by age 14 and 75% by age 24. So those critical moments in adolescent development and then in college years and all of that. You know, our mental health data will definitely see in years to come how it was affected by COVID, you know, how it's affected children, virtual learners, healthcare workers. And I think I just took a snapshot of some things that were in the news when I just did COVID mental health impact. You know, so we've had ICU nurses have impacted. healthcare workers, adolescent health, so all of these things that we may see in the years to come on research that's being done and how we're seeing more folks need help with mental health. Right now, Burke has stayed pretty level with our access of services and some kind of lower because people not wanting to come in, and we do have televideo and telephone services available, but some individuals may not feel comfortable with that also. But we also are a little worried, and we'll have to look and see how the unemployment going away in Texas in a couple of weeks, or how that's going to affect individuals as well, and just something to consider. And kind of depending on the level of resiliency a person may have, COVID can affect them more than others, whether that's grief, what they've seen in the news, how they've been affected in all kinds of ways. So it's really interesting. So this is a snapshot of mental health disorders or mental health conditions. And this is adults, a 12-month period of adults in the United States. So it's like 2019 data. So,
Kinnie, can I interrupt you for a moment?
Yes, sir.
I'm sorry, but your slides are not coming through. And I just wanted to let you know that. I don't know if you can.
At all? They're not showing?
No, ma'am.
Oh. It says you can see my screen.
We see the cover screen with the beautiful landscape and water, but other than that, we don't.
Well, I can try and turn it off and then turn it back on.
Alrighty.
Because I've been going through slides. Let's see. Now, do you see it? You got it? Okay, yay. All right.
Yes.
All the other stuff was text. This is where we get into the map. So this is an interesting graphic of so it's 20, basically, to kind of look at this, 19% of adults have anxiety disorders. And that's not just like stress and, normal stress and anxiety. It's kind of more like diagnosable stress and anxiety. Generalized anxiety is about 4% of that. And some of this may be like phobias and different things like that. But another thing that you kind of hear about is like bipolar disorder. It's only 3% of the adult population. And, a lot of times people will say, this is kind of talking to the stigmas that we hear about mental health. It's like, oh, she's so bipolar, you kind of hear stuff like that, or, oh, so OCD, or so, that sort of thing. So, we have to be careful when we talk about and label people, and that could affect them from getting treatment, or somebody hearing those kinds of things could affect them from being diagnosed and from getting treatment. And really, for somebody to be kind of diagnosed bipolar disorder, it's like, because, bipolar disorder is moods, ups and downs, swings and things like that. And, they may be really, really depressed and really, really manic, where they're doing all kinds of things and productive and all that. But it's not just like a day at a time. It's like 2 weeks, in each period. And so to be able to be diagnosed, and I don't like to spend a lot of time in this because I think it takes a mental health professional to talk about all these different diagnoses. But the thought is that, they are real, they are treatable, and we want to be careful how we talk about them. All right. So some common warning signs that we may see in individuals, and what we kind of learn in our mental health first aid class. And so that's a 6 to 8 hour class where you're learning these things and how to apply them and practicing and how to talk to individuals. And so, but what we kind of look at these warning signs, almost like the warning signs of a stroke, but not exactly. A stroke warning signs are all of a sudden, it's not that somebody's been a certain way, for a couple of weeks. It's that they've, been a certain way all of a sudden, and it's a major change in them, So somebody that's feeling very sad or withdrawn for more than 2 weeks, it's not just a regular sadness of, broke up with a boyfriend and sad for a couple of days kind of thing. It's a couple of weeks, really, really sad and depressed and not interested in life. Seriously trying to harm or kill oneself or making plans to do so. So any of those types of language we really take seriously, and we'll talk about that in a little bit. Severe out of control, risk-taking behaviors, that's common. Sudden overwhelming fear for no reason, kind of an irrational fear. Not eating, throwing up, or using laxatives to lose weight, significant weight loss or weight gain. So those are kind of seen with eating disorders, which are considered mental illnesses that can be at risk for problems. Seeing, hearing, or believing things that are not real. So kind of that delusional kind of things. And that's more related with schizophrenia and psychosis. Repeatedly using drugs and alcohol, so kind of that excessive use. Drastic changes in mood, behavior, personality, or sleeping habits. That's another thing is, you see a drastic change. So someone that's gone from being normally steady, happy person to being more irritable or more angry or that sort of thing. Extreme difficulty in concentrating or staying still. So that's extreme. Some of us may be, naturally kind of concentrate or distracted, or, you see people that are, we're distracted by our phones or other things that are going on. That doesn't mean a mental health problem, but, it's where it's really, really excessive. Intense worries or fears that get in the way of activity. So not doing something because you're really worried about it. Not going to a certain kind of event because you're worried about being in a social atmosphere. So the other thing that I say with these things, and we're not diagnosing our friends, but we want to look out for sudden changes and how to help them. And but it's seeing that it's really affecting their ability to go to school or to perform well in school, or affecting their ability to interact with friends or coworkers or people or their spouse or family members. That's where it really, is seen as a serious condition, and where you would really, it's affecting your ability to live, laugh, and love. So to talk about these things, what we recommend, and this is kind of from, these slides are from NAMI, the National Alliance for Mental Illness, and they have some great resources, as well as our mental health first aid class does, and I'll share that info with you. But, kind of the I language, I've noticed these things. It worries me to hear you talk like this. Let's talk to someone about it. I've noticed that you haven't been acting like yourself. Is something going on? Or is, can you tell me what's going on? Those open-ended questions to get someone talking. The biggest thing is that they know that you care. I've noticed that you're sleeping more than you used to. Notice that you're eating less than you used to. Is something going on? So that you get them to talk. You want to offer support. It's okay to recognize that you may not know what to say, or you may not have the answers. And that's where, you would point to, a place like Burke or our website, or, and I'll share our crisis hotline with you. If somebody's at, risk of hurting themselves, or, you're just not sure, you can call those numbers. It's like always with general first aid, I used to recommend, well, if you're really not sure if you need an ambulance or not, call them and they'll tell you if they need to come or not, or they can at least check it out. You admit your limitations. I really want to help. What can I do to help you right now? Would you like me to go with you to a support group or a meeting, or go with you, give you a ride to any of your appointments? It might just be somebody that can pick them up and take them there and sit in the waiting room while they see a therapist or something like that. We can sit down together and look for places to get help. I can go with you too. Being patient, being understanding, and providing hope. And that's the biggest thing is we teach, provide information. Here's some resources, provide some hope that help's available. And it's not, it's okay that you feel this way right now. You also don't have to feel this way forever or for longer, than this. So these are kind of some tips too, is, don't leave them alone. If they are, if we get to the they're talking more, hoarding themselves, you definitely wouldn't want to leave them alone. But then if they're just, if they're depressed and, you're encouraging them to get some treatment, check in with them regularly, include them in some plans, invite them somewhere, or like pick them up, take them somewhere. You can learn more about mental health conditions. NAMI is a great resource. There's also mentalhealth.gov is a great resource to just learn more. I heard a great speaker that said when he was diagnosed with bipolar, his uncle gave him Bipolar for Dummies. So kind of learning all of those things and how it affects other people. Avoid saying things like you'll get over it, you're fine, don't minimize it. And also, not the toughen it up, pull yourself up by your bootstraps kind of language. You have to help individuals get through things. So just some other tips for encouragement. And I always kind of say is that hope and help is available out there. And then if you're not the person to talk to, have them identify a person that they can talk to also. Another friend, or, maybe a coach or a teacher, or, if it's somebody else at the work site, if it's a coworker, encouraging them to find the EAP. A lot of companies have employee assistance programs that you can do a certain level of therapy for no charge for so many sessions before you even do pay a copay. So looking into what's available. And then sometimes like a minister, a church person can be a great resource for those things as well. All right, so I always say that it's okay to talk about suicide. It may be very uncomfortable because a lot of us have probably not ever asked that question, are you thinking about killing yourself? And we teach not to necessarily say hurting yourself, because some individuals, hurting doesn't mean killing, and that's why. Are you thinking about, have you had thoughts of suicide? Are you thinking about ending your life, or whatever, kind of is comfortable for you? But it's okay. It's not going to put the idea in their mind. And that's kind of what we want is, and the other thing is suicide is treatable and it's preventable, seeing that 90% of people who die by suicide have experienced symptoms of a mental health condition. A lot of times it happens and folks feel a little bad because it's like, why didn't we reach out? The other thing, it's not your fault if someone completes a suicide, dies by suicide. We want to reach out and help them. We've definitely seen an increase, 31% since 2001. And it's definitely something that, needs to be talked about. Kind of these are some other statements that can be reiterated. They're just, the thoughts are a symptom. They can be treated and they can improve over time. And it's important to include a professional. I always recommend having a suicide hotline number saved in your phone. I'll show you some of those resources here in a second. And Kelly, if you want to put those in the chat, they're handy also. Whoops. So the National Suicide Prevention Hotlines, like, the place to go. Lifeline chat, you can go to suicidepreventionlifeline.org, or you can text home to 741-741 and you can text with somebody, because sometimes there's people that don't, they don't want to have a conversation out loud, and texting is easier. So, and then like all of these things I found by Googling, just Google suicide hotline and they'll all pop up. Burke's number, so to kind of activate our crisis response team, is this number, 1-800-392-8343. So this is our regional crisis hotline. Someone's experiencing a mental health emergency, so we say danger to themselves or others. If you feel like it's a very immediate physical danger that they're hurting somebody, 911 would want to be involved and have law enforcement involved. We try to, and we have a regional Rural East Texas Health Network, works regionally with law enforcement and healthcare providers. And in each county, we have a local board. So in Nacogdoches, we have a local advisory board that meets quarterly, and it has our judge, our police chief, the sheriff's office, people from the ERs, all of those that are kind of involved and more likely to see individuals in this situation. And so what we've tried to do is prevent the ER being the first place for someone that may be thinking about suicide. Is calling our hotline. We can activate our mobile crisis outreach team. We can send a staff person to a safe place. So it might be sometimes an ER or a sheriff's office or somewhere else. You know, we've talked to Whole Again Counseling, you know, making that a safe place, you know, or Burke's office, making that a place where we can come and do a crisis assessment and then get them into our system. We do have a mental health emergency center that's in Lufkin that serves our region, and it has a 3 to 5 day average stay that's getting an individual stabilized. They are treated, you know, maybe it's getting medications straight, getting them back on medications, you know, giving them, you know, sometimes 3 hots in a cot kind of thing to figure out and make some plans of where to go from there. And there is a little bit longer stay, and sometimes a warrant is, you know, and that's law enforcement language that I'm not super familiar with, but if a person is not going willingly, they can be, what is the word? There's a word for it, but they can be taken involuntarily, depending on where they are with law enforcement involvement. So I always recommend having that number, and that kind of activates our system and gets them in our services. If it's somebody that just needs care, you know, they can get into our intake system or getting care at, you know, one of our other great providers here in our community. And we are fortunate. We do have, you know, there's more, I think, psychiatrists in Nacogdoches than there are the rest of our other communities. And but there's all kinds of providers, counselors, and social workers that can see individuals. Sometimes you just, you know, talking to your healthcare provider is helpful too, and, you know, getting through some different things. Some of our other resources, I talked about NAMI, mentalhealthtext.org. You can find local health providers on there. We have a My Strength app. I kind of call it Pinterest for mental health, and it'll have different articles, and you can search different topics. If you want help for smoking cessation or stress management, you can download this app on our website, myburke.org/mystrength. There is a code for our Burke community, but it's free to use, and you set up a profile and you can do a little stress management, you know, read some articles, watch some videos, learn some things kind of deal. Our COVID hotline, I've shared that with you guys before. For anybody that's having worry or stress, we still have this around. Our grant ends at the end of June, but I think the hotline will stay open because there's some other providers that are still participating in this funding in areas that are more impacted than ours. So the 833-986-1919 is that COVID hotline, and then it'll direct them to services in our area if they need them. And I think, oh, I talked about mental health first aid. You can contact me if you're interested in a mental health first aid class. Okay, it's catching up. I hit my button too fast. You know, we encourage this. It's about 6 to 8 hour course. We do some of it. Right now they're working on hybrid version where you do some of it on your own, on videos that you watch, that sort of thing, and then you do some of it in person. We've been doing them by Zoom, you know, and then, but we'll soon be switching over if groups are comfortable and our staff that are training are comfortable with that. So let me know if you're interested in a mental health first aid course. It's great for HR managers, safety officers, law enforcement, anybody that works around lots of people. you might benefit from this course. And there is adult version and there's a youth version, and we teach the youth version to our school staff in our area. Now, I want you to take a minute, and I know we have lots more to learn in this, or, for our other presenters to share, but if you can write down 3 things that you can do. So what can you do to help mental health at your work site? What can you do to help your mental health? Put those crisis hot numbers in your phone. Do some stress relief activities with your team. Sometimes it's just seeing how people are, bonding with them a little bit before you jump into the day on what's going on and what everybody needs to get done. Check in on people that are working remote. If they're not working in your building and you're not seeing them every day, check in on them, see how they're doing. That isolation can be tough on people. You could investigate your insurance plan and your EAP and see what they have to offer so that you have that information when somebody does need it. You can download the MyStrength app. You can call me about a mental health first aid course. Or if you want me to do a presentation similar to this, and we can also bring in one of our counselors who can speak a little bit more, deeply. I have a stress management presentation that I can always do, and then some wellness tips, because there's things that we can do with our eating and our physical activity and with getting sleep and all of those things that can help our mental wellness. All right, and so that's my wrap. I'll give it back to you, Wayne, and if there's any questions.
Thank you very much, Kinnie. Any questions of Kinnie about her presentation today? Kinnie, I have one quick one. Is it possible that your staff can assist some of our businesses if they feel as though they could benefit from a more proactive program internally?
Yes, we can. And just depending on if that's, I did last month, I did a presentation with eTech to their leadership team. I think it was like 50 or 100 people all over. They had folks in Houston and Dallas. And that's the joy of Zoom and things like this, to be able to share. But, we can, I think talking to a leadership team is helpful, or, to any individuals, whether it's education or where it's looking at, what do they have available in the system? And that's something I can help them with, or, find folks in our area just so that they know about the resources. Some of the different work sites do invite us, like eTech invites us to their health fairs. If they have those, SFAs invited us to some of their wellness fairs, start getting those going again, possibly. But we try to be out there and let people know about what we do. But every day I hear, a lot of times I hear, oh, I didn't know you did that, at Burke. And we are 80% mental health services. And then we also do the developmental disability services and early childhood intervention. So that's 0 to 3.
That's great. Well, I want to call all of your attention to the chat section of this call, and you'll see a lot of resources that Kelly has posted as well. And Sherry Cheney has added some things that could be helpful for a free workshop. So, Kinnie, thank you very much, and thanks to the folks at Burke for the great job they're doing here for the citizens of Nacogdoches County.
All right, thank you, Wayne.
Well, I'm pleased to welcome the president of Stephen F. Austin State University, Dr. Scott Gordon. Good morning, Dr. Gordon.
Good morning. Hope everybody is well. We are officially 100% open. The governor's executive order that came out resulted in us rescinding the mask requirement, and all occupancy on campus is now open 100%. Knock on wood, we expect to stay that way throughout the next, forever. And we do have a lot of summer opportunities for anybody who's interested in taking classes. working hard to get our enrollment numbers where they need to be for fall. But if you or you know of anyone who's interested in taking summer classes to maybe get ahead a little bit, we have a lot of opportunities for basically 12-week, 10-week, 4-week, 6-week, 8-week classes, and a lot of opportunities for face-to-face as well as hybrid and online. So I would encourage you to go to our summer 2021 website and look and see what's there, and you might find something that's of interest to you. And that's my report.
Thank you, Dr. Gordon. Any questions of Dr. Gordon? Well, thank you very much for joining us, Dr. Gordon. We really appreciate it. I'm not sure that the city manager is online, but is Mr. Canizares online?
I don't think he is, Wayne.
Well, then I'm pleased to introduce the president and CEO of the Nacogdoches Economic Development Corporation, Larissa Philpott. Good morning, Larissa.
Good morning, Wayne. Lots of good things going on. Some of you in the chamber board meeting this morning already heard this, but we have a ton of activity. It I believe is at a higher level than it was pre-COVID. So I feel like we are full steam ahead in recovery. The job market is really strong. Everybody in town is hiring. The labor market is still kind of weak, but we feel like that's starting to level out, starting to kind of even up with the $300 unemployment benefit ending last week. The local workforce commission offices are anticipating more workers coming in looking for jobs. Reminder about Restaurant Week, which is the last full week in June, June 20th through the 27th. And I had one more item on here. Oh, Entrepreneurship Academy, our Spanish language Entrepreneurship Academy is tonight at the Sacred Heart Catholic Church. That's all I have. Thank you.
Thank you very much, Larissa. We appreciate it. It's refreshing to hear that there's so much increased activity in all sectors of our local economy. It's great news. For our hospitality update, I'm pleased to welcome Visit Nacogdoches CEO Sherry Cheney Morgan. Good morning, Sherry.
Good morning, Wayne. Good morning, friends. Briefly, I wanted to thank Kinnie for her thoughtful and mindful presentation. I make no secret that I utilize treatment at Burke myself personally. I moved to Nacogdoches with a lot of things that I had never unpacked mentally, and decided to make that investment in time and energy in my own mental health. And as the mother to 2 daughters, if I could do anything that would just give me more tools in my toolkit to help save them some of the harder lessons that I learned, I'm committed to do it. So we've got phenomenal resources here. I was one of those people that would give the shirt off my back to anybody and help them, but never want to burden anybody else with my problem. And now I have a therapist, and that's his sole job is to listen to my problems and help me find those solutions. So yeah, I'm a kinder person to myself as a result. So 2 big thumbs up. Let's normalize making mental health a priority. In hospitality, I'm pleased to announce that we received our latest Smith Travel Research Report, which reports our hotel occupancy. And for the month of April, we saw an increase in occupancy of 92.2%. That's amazing news. About half of that was from last year with COVID. And so that's not as big of a deal, but about 42%, 42 and some change was up even from 2018 and 2019. So pre-pandemic, good news. So that's some good squishy. We anticipate May to show us comparable results as well. So that is amazing for us. This weekend is Memorial Day weekend. Friday is the next installment of Knack Snack Friday. I encourage you to come out for lunch and dinner and enjoy some live music and food trucks around the Plaza de Principal. On Saturday, we will be having the first of our Full Moon Summer Concert Series, and it will be with the band Already Gone and Eagles Tribute Band. Tickets are still available. Encourage y'all to come out. It's gonna, I think gates open at 6:30 or 7. Come on out on Saturday. On Sunday, the Wednesday Rotary will be installing the Field of Honor, the beautiful flags that are illuminated in Festival Park. So that Festival Park will go from the 70s Eagles tribute rocking out to the next day, very somber, reverent acknowledgement of those men and women who have given their lives in service for the liberties that we enjoy today. Several of our eateries around town will be offering brunch specials throughout the long holiday weekend, and coupled with some live music. And then on Monday, on actual Memorial Day, Visit Nacogdoches has partnered with Stonehouse Kitchen, as well as the VFW Auxiliary Group. On the backstage of the CVB, we will be having a Fallen Comrades table. We'll have a brief presentation that discusses the symbolism involved in that act, as well as a video presentation of some local men and women who have given their lives in service. And poppies will be handed out in remembrance of our veterans. So this is our official launch of summer in Nacogdoches, and we are so excited and so pleased. Over in the chat box tomorrow at 2 p.m. there is a free webinar being put on by our friends and partners at the Texas Forest Trail region. The three presenters, Holly Fornicay, Ryan Polk, and Sierra Polakritis, they are so talented. If you have somebody on your staff that handles your social media, this is something 100% you need to have them check out. You will walk away, they will walk away with so much yummy, good knowledge on the ever-shifting algorithms of social media. But that's a good one, and it's free, and it supports one of our great partners. So as always, it's an honor and a privilege to represent Nacogdoches, and we thank you here from Visit Nacogdoches for everything that you do in ways big and small to help make Nacogdoches a great place to visit.
And thank you, Sherry. Any questions of Sherry? Well, thank you again, Sherry. You've got a very busy week and month ahead of you. It's obvious to us. I'm pleased to welcome with us for an update on the social services, the President and CEO of the Nacogdoches Area United Way, my colleague and friend, Gary Lee Ashcraft.
Well, Kinnie, you did a good job presenting, and you hit on every button that just confirms and validates that I am totally crazy. So Charlotte knows that as well. One of the neat things about the United Way is we're connectors. And we know pretty much what, between Caroline and I and volunteers, where to get help in Nacogdoches County and the region as we serve Shelby and San Augustine. So if you have a friend or yourself or whatever that needs something, you can't figure it out, you can also call us, call me on my cell, and we'll get you pointed in the right direction. The only thing that I wanted to visit about, I think Kelly's going to put this up on the chat and possibly the website, is Anita Humphreys sent me an email yesterday after my request for the specific detail on where to get COVID testing, where to get vaccinations. The deal is that more than likely, as COVID gets conquered, I hope forever, the bigger shops, the expo center affairs, and the big events to get people vaccinated will kind of fade away. And the East Texas Community Healthcare Center will be taking on an ongoing role weekly. They'll be open Monday to Friday or Tuesday through Saturday. I'm not sure which, to do these things. And one is just to if you have a need, you need a vaccination, your team does, your employees do, you can do one of two or three things. You can call East Texas Community Healthcare Clinic at 936-560 5668. I'll repeat that if you want me to. You can go to their website, which is www.etchc.com for information. If you are a company that I was talking to Tara Agwin this morning about pilgrims, and she and Anita will get together, I'm sure. The team, they're working on this to get it perfected, can come to your location and do COVID shots or do COVID testing, either way. So you would call the East Texas Community Healthcare Center and ask for Chantel Comans, and she's the coordinator of all of that type of activity. So they're able to come to you, or you're able to go to them, and this is going to be ongoing. Anita has a pretty substantial grant to make sure this happens, and with that effort, my hope is that we can get everybody vaccinated in some of the underserved areas. As I mentioned before, John Cannings with the Solid Foundation has a wonderful fleet of vans donated by Tipton Ford, and he can go out and pick up groups like in Oak Hill Plaza. There's a plan to pick up groups and bring them to the clinic because they don't have transportation, some of those folks. So there you go. That's the most important thing. Of course, I've said all the things needed about the day of caring and our kickoff and all of that. All of that is listed, I hope, on our website. And I think Kelly was kind enough to put it on the chamber website. So if you have any questions, United Way, feel free to call me or Caroline or the office, and we'll get back to you. Thank you, Wayne, for this opportunity. I appreciate it.
Thank you, Gary Lee. Appreciate you and all you folks are doing for Nacogdoches. Any questions of Gary Lee?
Bring it.
Just to dovetail on that, it's my understanding is that we'll be announcing soon that the COVID vaccinations will be available during the day in downtown Nacogdoches. So just watch for more information on that very soon. So I'm pleased to welcome Aaron Wyndham, the communications expert for the Nacogdoches Independent School District and a super chamber volunteer. Good morning, Aaron.
Good morning. There is an unidentified flying object in my office, so if you see me like jump, it's like diving at my head right now. We want to let you guys know that our NHS Senior Parade will be at 6:30 tomorrow in downtown Nacogdoches. The seniors will begin arriving for staging at 5:45 behind TJR in the parking lot. Also, Malcolm Rector Technical High School will hold its graduation in 2 parts on Thursday, May 27th in the NHS auditorium. Graduates with last names beginning with A through J will be in the 6 p.m. ceremony, and K through Z will be in the 7 p.m. ceremony. Finally, graduation for the class of 2021 is set up for 8:00 p.m. Friday, May 28th at Dragon Stadium. Each graduate will be provided with 10 guest tickets for the ceremony, which would allow for attendance at Dragon Stadium to be at 50% occupancy. Guest tickets will be distributed to the graduates directly during the required graduation practice held the day of the ceremony. Everyone attending the ceremony is asked to wear a mask, and there will be multiple kiosks of hand sanitizer available throughout the stadium. The mask requirement is still in place based on directives received from the Texas Education Agency. Once inside Dragon Stadium, guests will be asked to social distance between family groups. Both sides of the stadium will be available for seating. Because graduation ceremonies are planned outdoors and we're watching the weather closely, 2 alternate dates are in place in the event of rain: Saturday, May 29th and Saturday, June 5th. Also, that is your message from Les Linebarger. Here's a message from Aaron Wyndham. Convocation planning has already started up. So in your respective businesses, please look for upcoming emails on how you can participate in welcoming our teachers back in August, because that is, although the last day of school hasn't taken place for us, coming back is right around the corner. Thank you.
Erin, thank you. It's a busy week for those of you in the school business, and we wish you great success. I know how wonderful the graduates are looking forward to the graduation ceremony, and I look back in my high school career, and it was the best 6 years of my life. So there's a joke in there someplace, but again, thank you very much. Well, another very busy person that has done an enormous amount of work in the last year and a half in the area of COVID and communications with the city of Nacogdoches. Would you please welcome, Jessica Sala. Good morning, Jessica.
Good morning, Wayne. Thank y'all for having me, and I'll try to keep this short and sweet since I know we only have a few minutes. So I have one announcement that's COVID related and one that has nothing to do with COVID whatsoever. So we have 2 upcoming COVID clinics, vaccination clinics on the 26th, which is tomorrow, and then June 2nd. Both of those are at the City Recreation Center, the CL Simon Recreation Center, which is 1112 North Street. There's still appointments available, and those will be Moderna and J&J vaccines. And of course, you can sign up anytime by going to our tinyurl.com/vacnac. The city and the county are kind of moving out of the vaccination or the large vaccination game because we have so many other great healthcare providers and great partners that are doing some of those small vaccination clinics. So we don't have to do, 1,000 people in a day anymore, thank goodness. And so these will probably be our last 2 bigger ones, and then we'll transition to more smaller ones aimed at businesses, groups, schools, things like that. And actually, I lied. Our last big one will be at the Blueberry Festival, where we will have COVID vaccines available at our downtown fire station. And we'll have, we're working with Kelly right now for the advertisements for that. And so that will go out as well. So that's our COVID update. My other update that has nothing to do with COVID is, I don't know if y'all have heard or seen, but you will soon because we're sending out a lot of advertisement on this right now. But the city is starting the comprehensive planning and downtown master planning process. Both of those plans are very out of date. The downtown master plan is actually older than I am. It was written in 1974, and so it's out of date, needs to be rewritten. Our comprehensive plan for the city, I believe, is 20 years old, maybe older than that. And so those plans, which kind of lay the framework for what Nacogdoches is aiming for and going to look like for the next 30 years, those are kind of our building blocks. So we are starting this process with 2 public forums, June 7th and June 8th at 6 p.m. June 7th is at Commercial Bank of Texas, and June 8th will be at the City Recreation Center. The public forums are our chance to kind of tell the public, here's what a master plan is, here's why we need them, here's how the processes work, and kind of here's where we are in the planning. Right now, we have interviewed several firms that would be writing these plans for us. We've interviewed them. We have not awarded contracts or done anything like that. We first wanted to reach out to the public and kind of see, okay, what do you think about this? Tell people kind of what we're doing, make sure everyone understands what's going on before we move forward with it. So we encourage everybody to come. It's free, open to the public. We'll do a short presentation, and then whoever comes will have a chance to ask questions and also sign up on an email list so that way you can keep in communication with us and we will update you. So those are my 2 updates, and I'm happy to answer any questions if y'all have them.
Any questions for Jessica? Well, again, as you transition out of the COVID business to some extent, Jessica, I want to commend you and the unbelievable job you and your colleagues have done in helping us move toward recovery from that pandemic. It's wonderful work, and you should be very proud.
Thank you.
Moving on, just my closing comments. We want to remind you, Eggs and Issues will be this Friday, and it will be on May 27th at 7:30 to 9. It's going to be a very interesting presentation by Dr. Ryan Head, pediatrician, and Ryan's going to talk about the vaccinations for 11 to 15-year-olds and provide some direction for those of us that are parents and grandparents that are considering vaccinations for our youngsters in that age group. It should be a very, very interesting discussion. You can register on the Chamber website, and I'd encourage you to do that as soon as possible because we are filling up fast. Do want to let you know that the SFA Chamber Connection meeting will be on the second Tuesday of the month at 8:30 a.m. We do have the Texas Blueberry Festival on Saturday, June 12th, 2021, 8 to 4 in downtown Nacogdoches. And I'm pleased to say, based on what I heard from the staff this morning, we have over 250 vendors that'll be exhibiting there, just a massive number. And it's safe to say Blueberry's back. Then on Friday, the evening before Blueberry, on Friday, June 11th, we'll have the Blueberry Bluegrass Concert in the park from 6 to 9:30 p.m. There will be award-winning talent performing, I heard this morning, and that's pretty exciting. And then at 10:30 a.m. on Thursday, June 10th, we'll have a ribbon cutting at the Nacogdoches ISD Transportation Center. And I know I'm excited about seeing this new facility. I drive by it every day going to work, and it looks like a really nice operation. And I think we'll all get a real great tour and appreciation for how those bond dollars are being spent to help service the Nacogdoches Education Committee. With that, I thank all of you for tuning in. Remind you that we're going to every other week. So our next call will be on June 8th at 10 a.m. And I hope you all have a happy and prosperous week. Thank you very much, folks.